Okay, so now we're going to go over the selective spinal motion restriction protocol. This protocol is very similar to what we had before, but some slight changes. So, if you have a patient on the left side, if any of the following are true, blunt trauma with altered level of consciousness, spinal pain or tenderness, they have some kind of neurologic complaint like numbness or motor weakness after traumatic injury, anatomic deformity to the spine, or they have a high energy mechanism of injury, and any of the following are true. Drug or alcohol intoxication, inability to communicate, or distracting injury, then you apply a cervical collar. And if they're ambulatory, you can assist the patient to lay on the cot and secure them with seatbelts. If they're not ambulatory, use a long spine board or a scoop stretcher to lift the patient onto the cot and then remove the long spine board or scoop stretcher. So, uh, after you get the patient on the stretcher, you transport them off the longboard. Under no circumstances are we transporting any patients on boards anymore. Even in transfers, the protocol says uh, they're not indicated. So if you go to St. Joe or Baptist and they're insisting that you transport on a board, just take them out to the truck and take them off. It's our protocol that we don't anymore. Once you get to the hospital, you can log roll the patient, scoop or use a scoop stretcher or a slider or a long backboard to move the patient to the hospital bed and then take them off of it again. And then on the right side, if all of the following are true, they have normal level of consciousness, no spinal tenderness or anatomic abnormalities, no neurologic finding or complaints, no distractive injury, and no intoxication, then you don't have to put any kind of spinal immobilization device on them. And just a little note the protocol makes, just because they have penetrating trauma does not mean they need spinal immobilization. There used to be this thought that any kind of penetrating trauma needs spinal immobilization. That's not necessarily true. So,